Welcome to the COVID-19 series, NYU Wagner Alumni in Action. My name is Gordon Campbell, and I'm a professor of practice at NYU Wagner. The genesis for this series is to highlight those NYU Wagner alums who are on the front lines responding to COVID-19. Tonight's focus is the social services response to COVID-19, and I'm pleased to be joined by four distinguished alums. The format for this evening is that I'll have a conversation with each of the four panelists, followed by a group discussion with the panelists. And then we want to turn to you, the audience. And if you have a question along the way, just click on the Q&A icon at the bottom of your screen and type in a question. And we'll try to get to as many questions as possible. But before we turn to the panelists, let's look at the statistics. And these are statistics as of yesterday, October 21st. Globally, there were 41,313,000 cases of COVID. Globally, the deaths were 1,132,000. United States cases of COVID, 8,249,000. US deaths, 220,362. And right here in New York City, the number of COVID cases were 257,028, and the number of deaths were 23,949. In addition, 14% of New York City residents are currently unemployed. That's 1 in 7, or 538,000 plus New Yorkers. And yet a year ago, the unemployment rate was only 3.7%. So let's start with our first panelist, Monsignor Kevin Sullivan. Catholic Charities is a federation of more than 90 agencies that provide services that feed the hungry, strengthen families, along with integrating immigrants and refugees throughout the New York metropolitan area. In addition to coordinating the Human Services disaster response, Monsignor Sullivan represents Catholic Charities agencies in public discussions and issues such as immigration, job development, housing, homeless services, and the like. Kevin, welcome.
Gordon, thank you so much.
So Kevin, you played a big role in previous disaster responses, including 9/11 and Hurricane Sandy. Now adding to your experience with COVID-19, how are all these crises similar and how are they different?
So Gordon, I guess the first thing you're saying is saying that I'm old because I was around for all of those things. But you know where we begin with everything, Gordon, the commonality. There's always tragic human pain, death, loss, injuries. So every disaster has that type of commonality. And as usual, in those disasters, it's always the poor, the most vulnerable, that suffer the most in those situations. So that's a basic commonality. But the other thing I would say is, if we move beyond that, is they're all unexpected. And they're all taking us by surprise, even the natural ones, where you have a weather forecast that might give you a couple of days warning, but you never know until they happen. And so as a result, human service agencies are always playing catch up. You're always dependent upon your current existing infrastructure and capacity, and you're responding in the first days and weeks until you can build additional and disaster specific capacity. So you take whatever resources you have, you shift them around, you have to make timely decisions. Those are the things that are common to every disaster that I've experienced. But then if you go to the dissimilarities, they're so very different from whether it be the source of why they happen, the impact, and the needed response. So 9/11 was a geopolitical terrorist attack, but it targeted a very, very specific target, immediately deadly impact for 3,000 individuals. Superstorm Sandy was a natural disaster that struck hundreds of miles of the coast of New York and New Jersey, much less loss of life, but yet the property damage was huge throughout that area. And then you come to our current COVID-19 pandemic, 10 times the number of lives as 9/11, not in an instant, but over a 6-month period, and it's not ended. And the job loss, which you alluded to, the infection, so very, very different. And in this, nobody's left out, because even depending on how you act, you got to decide: are you wearing a mask? You're not wearing a mask. Nobody in the whole New York area, the country, be it the world, is left out. So those are the differences among those three disasters that I've experienced.
No, Kevin, that was very helpful in terms of the commonality, the death, the despair, all unexpected, and nonprofits playing catch up. But there's a similarity, and I think you're absolutely right. No one is left out, literally, around the world in terms of COVID. So you've seen, and we've seen, food insecurity nearly doubling since the start of COVID. With your food distribution initiatives like pop-up pantries, what have you had to do differently, and how did you identify and prioritize the areas that needed it most?
Okay, so let me say a couple of things. I mean, one of the things that most emergency supplemental food programs have been doing for the past decade, in order to make sure that we kind of try to respect the dignity of those whom we're helping, we kind of went to what they call a client choice food pantry. In other words, we set up our food pantries in like a little grocery store where those who were coming and needed food could come in, and they could take off the shelves the items that they wanted. We felt, and I think most people felt, it respected their dignity. Well, can't do that now. So immediately, what we had been working on it for 10 years, we now had to go back to repacking bags, put tables outside, and so people had grab and go types of meals. We provided 2.5 times the number of meals we would ordinarily have done. So that was kind of one example of that. We've all spoken about the remote learning that people have done. Well, we moved to remote counseling, remote telemental health, to remote preventive services. So those were a lot of the changes we did. And on the other hand, for some of the services and programs we had that were residential for special needs populations, those with emotional, with physical challenges, those we couldn't change very much, except we made sure that our staff had PPE, that we reduced staff not below a safe level, but to a level in which we could protect not only the lives of those we were serving, but those who were doing the serving. So those were some of the changes that we had to make very, very quickly.
I was going to say, all in a very short period of time. And Kevin, similar to food distribution services, an ongoing hallmark of Catholic Charities, and another you're so proud of, continues to be integrating immigrants and refugees. How has this changed during COVID, given increased barriers to mobility, primarily emanating from the federal government?
Sadly, Gordon, when we're having this conversation, we just, again, learned in the past day or so the incredible impact that the incompetent and the disastrous and the humane policies of this administration are having. Now they're admitting, when they're forced to in court, that they can't find over 500 parents of a problem that they caused by taking those parents away. I use that because it's such a poignant, ongoing example of the volatility that our current federal immigration protocols and procedures have, that we have been having to respond to. In the pandemic, again, the ongoing issue is because we failed to have comprehensive immigration reform, that we have over 10 million people who don't have the right documents. And so because of the divisiveness in our country, we kind of almost always say, well, if it's federal dollars, you can't help somebody who needs help if they are without the right document. Fortunately, we had some very, very generous New Yorkers who said to Catholic Charities and others, hey, wait a minute, that's unfair. These are our neighbors. These are our neighbors who are working. These are neighbors who are paying taxes into our economy. They're keeping us going. And so we at Catholic Charities alone, there were other groups too, we did what we usually don't do. We did over a $4 million cash assistance program, particularly targeted to immigrants and refugees who were left out of all of the other programs that are there. It is a disaster, the current situation, and quite frankly, it's only my opinion, but it's my opinion. What's being done now in immigration policy is using the excuse of pseudo public health concerns, and there are legitimate ones, but to do blanket policies which are betraying our American tradition of welcoming immigrants and being a place where refugees can come to seek help from persecution. Yes, there are legitimate public health concerns that we have to care about, but we can't use this pandemic as an excuse to keep out all immigrants, all refugees.
And Kevin, your point, without social service agencies, without nonprofits, so many more immigrants and refugees would go unassisted. And I also remember you sharing with me that there weren't a lot of questions asked when you were distributing the dollars. When a family presented themselves, the assumption, and rightly so, was there's a need for that particular family. So thank you very much. So our next panelist is Jennifer Jones Austin. FPWA is an anti-poverty policy and advocacy organization committed to economic opportunity and upward mobility for low-income communities, reaching over 1.5 million people in New York each year. As CEO and executive director, Jennifer has led significant changes in social policy and law in New York to strengthen, empower the disenfranchised and marginalized. Jennifer, welcome.
Thank you. Good to be here with you and with my fellow alums and friends.
Absolutely. So Jennifer, you've had extensive experience with nonprofits in helping traditionally underserved communities. How have you seen the organizational goals and the organizational operations of nonprofits shift over the past few months in light of COVID?
Well, the first thing I'm going to tell you is that when you read my introduction and you mentioned that the organizations with which we work serve and support more than 1.5 million New Yorkers, I thought to myself, that number surely is significantly higher today because of COVID. Because what I've seen is that the nonprofits across the city of New York, those who partner with FPWA, Catholic Charities, UNH, UJA, and other institutions or working by themselves are all trying to do as much as they can in this moment. These are the organizations that long before COVID were serving the people who were most challenged in New York City. And the people who were most challenged in New York City became all the more challenged because of COVID. So these organizations, child welfare organizations, found themselves delivering food supports. These organizations may have been providing youth services, and all of a sudden we're also doing meals and trying to figure out how to get emergency rental assistance to families of young persons they're supporting. We saw that organizations that were engaged in the work of elderly supports or childcare were now also centering on mental health supports for the individuals and the families that they serve. So what we have seen a lot of is people expanding their portfolio of service when and however they could to be responsive to the need. We saw a lot of emphasis being placed on the needs of the staff themselves. So all of a sudden organizations were appreciating that their staff were challenged in how they got to work, or challenged when it came to, providing for PPE needs, as Monsignor Sullivan spoke to, but also experiencing firsthand trauma, the trauma themselves of being essential workers and having to, go out into the world and provide services to people in need and putting themselves at risk and fearing that they were bringing the virus home to their families. So we've seen nonprofit human service agencies focus on trauma of clients, but also trauma of their staff persons. And then this overall challenge of having to do more with less as the government began cutting back, but this need being ever growing. How are they going to manage that? A lot of organizations engaging in advocacy. And then a lot of them beginning to think about how to plan beyond COVID, appreciating all the challenges that present now and in the weeks and months to come.
Yeah, so Jennifer, the social service organizations that you work with and the others that you mentioned have to continue to do the work they were doing, but all this additional work, and at the same time responding to the challenges and needs that staff are facing in a realistic and oftentimes very scary way. So Jennifer, nearly 1 in 5 New Yorkers live in poverty, the majority of whom are from communities of color. You've been an advocate for developing race-conscious policies to combat these disparities. And how has the COVID crisis impacted development of these policies? Has it helped or has it hurt?
So you know me, Gordon, the eternal optimist. So I am kind of hanging on the side of it's going to help. And why is it going to help? When we begin to see Black and brown persons suffering disproportionately from COVID, people were all aghast, like, how is this happening? Why is the infection rate higher? Why are they dying? Why are Black and brown persons dying at disproportionate rates? And very quickly we began hearing the social scientists and the health practitioners talk about comorbidities, speak about the social determinants of health, how poverty is a stressor, how education and the lack of quality education puts Black and brown persons at a disadvantage, how low wages challenge people and lack of access to jobs with fair benefits that allow for paid sick leave. We learned about lack of quality access to quality healthcare and how all of these are social determinants of health. There's this line that is often said in the Black community that when America catches a cold, we know that Blacks catch pneumonia, right? And COVID brought that to bear, and it helped us to look at all of the systemic racial disparities, all of the racist policies and laws that have permeated our society for so long that have kept Black and brown persons at a disadvantage. Women and transgender persons at a disadvantage. And so what I'm hoping and believing and trusting is that COVID is putting a spotlight on these issues, and it's going to allow us to just center on racial inequity in the form of housing, healthcare, education, economic inequity, and allow us to just kind of plow on through and say, we've got to deal with all of these issues.
No, Jennifer, you always have been a glass half full kind of person, which I appreciate. And speaking of stressors, you're absolutely right. COVID is just one more stressor. But to your point, hopefully that spotlight can be that much broader and brighter. So Jennifer, COVID has significantly impacted nonprofits in their work with the communities, families, and individuals they serve, as well as financially. And you talked about the government. And given all these challenges, has the city and state stepped up to the plate?
Well, my co-panelists, like me, would have a lot to say about this. Very early on in COVID, guidance was slow to come when nonprofits were trying to figure out whether we were essential services and who in our organizations were considered essential providers and would be provided with PPE equipment and access to basic supports to do the jobs, would be provided with child care if they had to come to work. Guidance was slow to come from the city and the state. Then we saw that government, when they began seeing that they would come short on tax levy dollars, began slashing budgets and cutting critical non-mandated services, but services that are needed for vulnerable individuals and families. What we found is that we've had to fight for every single need in this moment. It's not to say the government is not sympathetic, but we get that they're dealing with their own challenges, but we've had to fight for every dollar because government itself has been fighting to figure out where they're going to get the resources that they need to pick up the trash, to pay the union contracts. But you can't balance the budget on the backs of poor people. So that has been our fight. We've been fighting at the federal level for economic stimulus, for the next CARES Act to come on board to give people what they need, direct aid to local governments, municipalities. We've been fighting at the state for long-term borrowing, and we've been fighting with the city to not keep cutting us. It's not to say that they are not are concerned or interested in the well-being of the nonprofits and the people for whom they care. But we're in this real big battle where when they need money, they first go to that which is non-mandated, and they cut.
But when they need services, they look to the nonprofit community and expect the nonprofit community to continue to
keep doing more with less and less and less.
Right. And then to your point, it's exacerbated even more by the lack of federal dollars flowing in terms of the CARES Act to the state and local municipalities, it makes it even worse.
Right. And getting caught up in the politics.
Right.
Right. It's like, the state doesn't want to look at long-term borrowing for the city to close the budget gap, the deficit, because if they do, then maybe they'll take the federal government off the hook for the economic stimulus. Or the city and the state are battling, as they have been battling on a variety of issues, our elected leaders. And so then we get caught up in all of this, and who suffers? The people who are already suffering.
Absolutely. Jennifer, thank you. And our next panelist is Alan Van Capel. Education Alliance offers high-quality, multi-generational programs and services to the diverse communities in Lower Manhattan, helping to enhance their well-being and socioeconomic opportunities. As president and CEO, Alan leads their network of community centers offering social, educational, cultural, and recreational services, programs, and events. Alan, welcome.
Thanks, Gordon. It's great to be here.
Great to have you. So, Alan, you have a strong background in coalition building that significantly influenced the passage of legislation allowing same-sex marriage in New York. How has COVID changed the nature of this process, both the policies themselves and informing connections between organizations?
It's interesting. I keep thinking about the quotation from E.B. White. New York is to the nation what the church spire is to the village, the visible symbol of aspiration and hope, and that the white plume is saying that the way is up. And I think how New Yorkers, specifically the nonprofit community, even business leaders, philanthropists have stepped up in this moment has been a real example for the rest of the country. I think New York has done so much of this right. And I think this is all about, for a not-for-profit, figuring out who can be helpful, and it's all about relationships and partnerships. So we know that there were 1.5 million hungry New Yorkers pre-COVID, and now there are 3 million hungry New Yorkers. There are 9 million people in New York, which means 1/3 of all New Yorkers are experiencing food insecurity. So we have to reimagine how we are getting food to folks. So we partnered with Rethink Food and Sean Donovan and Philanthropy and DoorDash, and we managed to get money to open up shuttered restaurants on the Lower East Side. We signed up hundreds of families to a special DoorDash app where at any moment when they were hungry, they can go onto an app, see a restaurant they're familiar with, choose the menu items that they wanted and have it delivered to their door for free. This moment about partnerships and tri-sector approach allows for a lot of innovation. And this was piloted here on the Lower East Side, in Austin, and in Washington, D.C. We found it really effective and are now trying to figure out how FEMA can make it part of their permanent funding in order to help the newly food insecure. We knew that the learning gap for kids growing up in low-income households during virtual learning, it was going to grow by 15 to 20%. And so again, with partnerships with the corporate sector and philanthropy, we managed to get thousands of tablets, Wi-Fi hotspots, and supplies into the homes of the kids who would need it in their backpacks, so that those kids would have a better chance at being successful in virtual learning. Another statistic was that for every 1% increase in unemployment, addiction goes up 3.5%. So we went into the public housing complexes across the street on Avenue D from our Center for Recovery and Wellness and recruited public housing residents to become peer navigators. And we trained them and paid them $500 for the training. And then they became evangelists for our organization and brought people who were triggered back into addiction into our site. And so this is really all about partnerships. And frankly, you know, the work that we've done with UJA and others, we've distributed $450,000 on the Lower East Side, mostly to restaurant workers and to immigrants who did not have the documentation necessary to get unemployment so that they can have checks to make ends meet. And, you know, so I think this is really a lot about partnerships and relationships.
No, absolutely. I mean, I think your point about relationships and partnerships makes so much sense, and also a very entrepreneurial spirit, which one would not always think is possible with a very large organization such as Educational Alliance. Alan, your team was very proactive, and some of this you referenced, with the community response, even before official lockdown orders were issued. How did you know how to respond so early in determining what your community would need?
I think we sort of figured it out. I mean, in the immediate response, I think, like Jennifer had said, you know, the city was really nowhere in giving guidance, right? And so we basically said, we're not, you know, when the school day closes, when it snows, we always say our programs will be open if the schools are open, and when the schools are shut, we'll shut, and it's our guidelines. So everybody says, you know, you follow the city. COVID came, we said, we're not following the city. We became the first organization to stop congregate meal service for older adults, even after the city said you have to continue serving older adults. We said, turn on CNN. The CDC is saying they can't be in groups together anymore. And so we created grab-and-go meals and then wrote this lengthy letter to the Department for the Aging, which then became the model for how senior centers were going to act in this moment. Moving on from that, though, our research and evaluation team really were very smart. I mean, I'm the least smart guy in our entire organization. Our research and evaluation folks said, look, this is going to go on for a while. We need to put a survey in the field every month. And every month we have to figure out what our people are going to need, because that's going to change. If you only ask them once, what they need in month one will change in month two. So as an example, people were not experiencing food insecurity in 1 month. Seniors were not reporting that they were lonely in 1 month. People were not needing cash support in 1 month. That all began to change in months 2, 3, and 4. And we have mapped this out. So if we do, God forbid, get a second wave, here in New York City, we have some indicators to tell us like what we should expect people are going to need and when they're going to need them.
I think the idea of a survey is so interesting, and knowing too that the needs are going to change, and they have changed over time.
And Gordon, and also for the staff, right? We've been polling the staff too, because the reality is that, you know, staff did not need mental health supports in month one, but a lot of them need mental health supports right now because they're dealing with this crisis.
Yeah, and I guess the question is, what was the transition like, just given the suddenness of COVID when it's all swung upon us, even though it was known couple months before, from both a customer, your client perspective, as well as from a staff perspective?
Yeah, you know, I love Elizabeth Ann Seton, and she has this, St. Elizabeth Ann Seton, a New Yorker, and has this great quotation that cheerfulness prepares the glorious mind for the noblest acts. And we were a very happy staff. Even in the middle of this crisis, we think, in the Baal Shem Tov in Judaism said to serve God without joy is to lead a very gloomy existence. And there wasn't a single moment where I think we weren't, joyful in how we did our work. Whether it was calls to seniors or making the plans, there was an energy and a dynamic spirit. It wasn't this gloom and doom. We were all sort of in this together. And I think that's the secret sauce for our organization, is that we managed to keep up our spirits, to lift each other up and to see each other first in humanity. And it sounds kind of touchy-feely for a nonprofit that's sort of the secret sauce. But I have to say, as someone who's done a lot of legislative victory, like legislative fights, there are a lot more defeats than there are victories. And if you don't look for the small victories in every day, then you're going to get defeated pretty quickly. And so I think we began an organizational practice of trying to find the victories, even the small ones, in every single day, and using that as the fuel to keep us going to the next one.
No, your point about in it together, I know culture, organizational culture, is something very near and dear to your heart, Alan. Thank you. So our final panelist is Erasma Barras Montecchiolo. Power of Two is a home visiting organization that uses evidence-based parent coaching techniques to mitigate the negative impact of adversity and trauma between parents and children. With Power of Two, Erasma has created partnerships with policymakers, community-based organizations, and social change groups to build support for programs serving low-income populations in New York City. Welcome, Erasma.
Thank you so much, Gordon. Happy to be here.
Glad you're here. Can you talk about how COVID-19 has exacerbated pre-existing disparities in marginalized communities? How did COVID-19 make access to service, particularly mental health services, more challenging?
Yeah, so throughout our COVID-19 response, we have really focused on healing from what we consider to be a triple pandemic for Black, Indigenous, and people of color. And I'm talking about a race pandemic, a health pandemic, and an economic pandemic. And the causes and effects of this triple pandemic are intertwined. And they manifest themselves in systemically racist policies and practices such as inadequate resource allocations to health services reaching predominantly communities of color. And as we saw in a study that appeared in the Journal of the American Medical Association not too long ago, for example, that the federal government systematically shortchanged communities with large Black populations in the distribution of billions of dollars in COVID-19 relief aid, which were all meant to help hospitals struggling to manage the effects of the pandemic. So the government allocated large chunks of a $175 billion relief package based on hospital revenue instead of the numbers of COVID-19 cases and other health data. And so this occurs in a context of overall poor quality care provision to the communities of color, with the US Department of Health and Human Services, for example, indicating that Black and Latinx people receive poor care on 40% of the department's care quality measures. So Black, Indigenous, and people of color face significant barriers to accessing high quality preventive services already, that would help promote long-term health and social emotional well-being, which really leads to higher risk of heart disease, obesity, depression, and so much more. And as we know, these higher rates of pre-existing conditions lead to higher rates of COVID infection and death. And so I saw all of this play out in Brownsville, Brooklyn, for example, where pre-COVID, we were seeing that the average annual citywide rate of psychiatric hospitalizations was approximately 600 compared to 1,900 psychiatric hospitalization in Brownsville. That is triple the citywide rate. And even now during the pandemic, and with the increased attention on and advocacy for mental health services, the digital divide has made it increasingly even more difficult for community access services that have predominantly moved online. So individuals without equipment or access to broadband can't really access a host of services smartphone, for example, doesn't mean that they have the technology literacy to really access mental health. And so these technology barriers compound with barriers that already exist, such as geographical accessibility and affordability, and make it extremely difficult for communities of color to access mental health services.
You're right, a triple pandemic, race, health, economics, the causes are so intertwined, and it plays itself out in so many fronts, and more often than not in a good way. So with your focus of power.
Exactly, and that.
Go ahead.
No, I was going to say that, the circumstances in which we've all been living is already creating a higher demand for mental health care, right? And unfortunately, our healthcare system is just ill-prepared to respond to it, to respond to that need.
Erasmus, with your focus on resilience in low-income communities, what does that look like in the times of COVID? What new challenges and focus areas has it presented for your organization?
Yeah, so, our work is deeply rooted, as you know, in healing, and healing can only really happen if you have healthy relationships and access to social networks. And so those relationships really do provide a reprieve from the systems that oppress people of color. And so when COVID struck, there was no reprieve. Many of us, as we all experienced, were isolated from loved ones and friends, and we were constantly reminded of our trauma and pain on television and in the news with images of George Floyd's death, Ahmaud Arbery, Elijah McClain, and countless others, and the continued brutalization of Black and brown bodies by police, as well as the hundreds of thousands of others that died from COVID. And so with our connections to the daily realities of the communities that we serve, we were acutely aware of the devastating impact that the pandemic would have on our families and our communities' physical and mental well-being. And so it was incredibly critical for us in the earliest stages of our COVID response to ensure the continuity of our parent coaching program to alleviate the growing stress and anxiety the parents and children were experiencing, as well as alleviating some of the financial burdens in the immediate term, as well as promoting longer term healing. So our first priority was to really, acknowledge our shared humanity. We're all living through this triple pandemic together, and it's important to recognize that families' minds were overwhelmed by all of the misinformation out there about COVID, and we're often worried about things that they rarely had to worry about before, like, for example, where to buy toilet paper during that shortage, or baby essentials. So we had to really focus on raising funds to provide all of our families with 3-month supplies of diapers and wipes and formula and cleaning supplies, as well as reusable masks. And all of this is in parallel with our efforts to provide immediate relief to families. We have also focused on working with stakeholders to amplify the community voices through broader social justice movements. So in partnership, for example, with the Ocean Hill-Brownsville Community District 16 Community stakeholders to map out community resources, assess local needs, engage in effective communications about community health, and ultimately build lasting infrastructure for ensuring that all community residents are really able to access resources and support.
So healing power too has always been important, but even more so in the age of COVID.
Absolutely.
Aressa, Power of Two does a lot of work, as you pointed out, on family-based services. Given that schooling and childcare are so different and so disruptive this year, how have you had to adjust your work to accommodate the current and ever-changing circumstances?
Yes, this has been an incredibly challenging time for our families, especially families that have multiple children in their home, some of whom are toddler, but also school-age children. And so really trying to adapt our programming in a way that is incredibly inclusive and that is also, like I said before, humanizing the interaction. So making sure that there's flexibility in our delivery model that allows for parents to share their frustration with the education system, to share the why they have opted out of doing in-person schooling for their children and have opted into remote learning, really understanding the context in which they're living. They're dealing with so much already, and like I mentioned before, with so little reprieve. And so thinking about, that context, how do we connect them to the services that they need? How do we ensure that we're providing the guidance that they're not receiving necessarily from the Department of Education around how to navigate technology to support your children, how to navigate, accessing services online, but also we have to do the same framework or framing for our team. So really understanding the challenges that our team is also experiencing, so similar to what Alan was saying earlier, making sure that we're providing opportunities for them to access childcare, making sure that we're accommodating their schedules to allow family members to participate in our programming, but also allow our team to be able to care for their children while also providing the support for families. And accommodating the larger family as part of our service delivery model.
So, I mean, I really like the fact that you were really empowering your clients, your families to share their frustrations, giving them a voice. It is difficult and so challenging. So once again, I will remind the audience, if you have a question, just click on the question and answer icon at the bottom of your screen and type in your question. But now I've got a question for all of our panelists. Throughout the course of the pandemic, how did you balance your response in deciding whether to radically shift gears, pivot your work, or stay the course? Radically shift gears, pivot your work, or shift the course. So Jennifer, we're going to start with you, followed by Alan, Erasmus, and Kevin. Jennifer.
Okay, so here's the deal. I'm going to make you all laugh. This is what you call going with the moment. The power in my house just went out. So I had to grab my iPad and come outdoors to be with you. The question is?
Oh, did you hear the question?
No, I was trying to get situated so I could see you and be on.
Okay, so throughout the course of the pandemic, how did you balance your response in deciding whether to radically shift gears, pivot your work, or stay the course?
So, as some on the call know, some on this event know, I'm a always kind of forward-thinking person and appreciating that you've got to be kind of 2 and 3 or 4, 5, 6 steps ahead. And so what we did was at FPWA, we centered on the immediate needs, but we began looking at what the potential budgetary challenges would be, not just for our organization, but for human service organizations across the city. So what we did was we sought to do something that you've taught me, Gordon, how to do while planning, how to be in the moment, be responsive to the challenges that are presenting in the moment, but always be thinking about what the challenges might bring down the line. So it's really been a process of looking ahead. An example for you would be, we immediately began looking at our revenues and our expenses, not just in the moment, but what that might look like in March if we were to lose revenue in certain places. And then how did we need to adjust our budget accordingly? And now we're doing the same thing for 21 and for 22. So that the importance of responding to the needs in the moment, but also looking forward to what is within your control and what is not, and planning accordingly.
So yes, the here and now, and looking ahead. Thank you. Alan.
Yeah, I think the first thing that we did was, where could we have impact in this moment? So the challenges that I identified before, and then said that is what we should be doing. And let's not get into a new business that we know nothing about. Let's do what we know how to do well and double down on it. Then the other thing we did was we said, let's just take a look at our organizational structure right now. Because the organizational structure, we anticipated, and we were right, that our budget would go from $50 million a year to $36 million a year, and that we needed to restructure internally. And so we merged 2 of our community centers together. We changed reporting lines, and we rethought how we would get our work done. And finally, I had my dad grew up in World War II. And early on in the pandemic, my father said, Alan, this is a lot like a war. You have no idea what day it's going to end on. And when it ends, things don't go back exactly like they were the day the war started, because all of us will change in some way. And I tell that story to us here, but I also said it to our staff to say, we just have to be mindful and listen to the communities that we serve, because they are changing every week because of this pandemic. And at the end of this, we are going to have to build a new social infrastructure, new programs to meet where they are. And I offer that up because I think if we just build back exactly like what we had before this pandemic, we're going to be missing out on helping a lot of New Yorkers who really need us.
So not new frontiers, but building on what Educational Alliance does well, and then not just going back to the same old, but what should be the new services and offerings going forward. Erasmus.
Sure. I mean, for us, it was incredibly clear from the start that we needed to really prioritize our communities and our team to ensure their health and well-being. So we made the shift pretty immediately to work from home for all team members, and developed and implemented in partnership with the University of Delaware, who they're the developers of the ABC model, a virtual tele-ABC model that would allow us to shift to serving or providing the remote tele-ABC delivery. And so, but we knew that in order to do that, we really had to understand the digital divide better. You know, we all knew it in the abstract, but weren't sure what that really meant in reality. And so we conducted a tech assessment with both our team and our families in the different communities that we're serving to really fully understand to the depth of the digital divide. And what we found was that 34% of the families in Brownsville, for example, lacked access to technology, meaning technological equipment, but also to broadband. And we saw that the same thing in the South Bronx with 40% of the families also reporting lack of access to technology and to broadband. And so our next goal was to identify ways to provide those equipment to families so that they would be able to connect not only to our programming so that we can provide them with support during the pandemic, but also because we knew that a lot of programming was shifting online. So if you wanted to apply for, unemployment insurance, most of the time you would have to do that online. If you wanted to have access to doctors, you would have to do that online because they were not seeing people in person. And so really focusing on partnering with the board to create a strategy for fundraising to help us raise enough funds and resources so that we could provide this technological equipment for our families, and also making it available for our team. Then in addition to that was creating, the actual mechanism by which to deliver all of these materials to the families, then creating user guides so that they fully understand how to navigate the technology that they had not been familiar with, and really supporting them through that entire process. Additionally, really focusing on our team internally, so developing the infrastructure to support our team who were already, are already from the community themselves that we're serving. And so they too were experiencing a lot of trauma and secondary trauma because they're supporting, lots of families. And so making sure that we were creating the internal infrastructure that would allow us to provide stipends for self-care, opportunities for them to, connect with a subscription to unwinding anxiety, and also opportunities for them to come together in a peer support way. And so was really trying to do the programmatic work by also looking at our finances and really budgeting and planning not only for, what we thought was going to be a 7-month-long issue has become even longer term. So really thinking forward about what to do over the next 2 to 3 years.
Yeah, so really figuring out how to work around the digital divide. Kevin.
Gordon, I think you asked us to say, well, what did we do? We did new stuff, or continue, adapt, whatever? The answer is all the above. I mean, and again, if you're dealing with more than a single program, you gotta do it all, and there's not the same answer for everything. The other thing is, and I've used this many times, is I'm sorry, but you sometimes have to throw precedent out the window. Some of my staff was not too happy about it because they wanted to know what the precedent was or what the policy was. And this is going back to 9/11. In that, I used to say to people, oh, here's our new policy. Anytime that two planes hit a building within 12 minutes of each other, this is the policy that we will use. You need to come up with concrete, community-based, specific responses to what the needs are in that time. And you may not have a policy that lasts forever, but you got to respond in that time. So you got to do new things. We in the nonprofit sector don't do a lot of direct cash assistance. We do a lot of services, but it's not a lot of giving people cash. Well, in this, because people needed cash and donors wanted us to distribute that, well, we said, yes, we'll figure it out how we do that. Some things you had to continue. You had residences for extremely vulnerable people. You couldn't close them. Maybe you did a little adapting. And I'll tell you, sometimes you just had to say realistically, we can't do what we've always done. Just within the past day or two, we canceled for the rest of this winter, winter and spring, our 15,000 youth basketball program, which was indoors, because we can't do it. So you gotta just realistically say, if you try to quote unquote save everything the way it was, you lose it and you don't respond to what the new needs are. So you just gotta be nimble. You gotta not be bound by precedent. You gotta know your limits, and you also gotta take risks. And the other critical thing is you gotta make mistakes. If you don't make mistakes, you don't help anybody.
Yeah, Kevin, I couldn't agree with you more about making mistakes and learning from those mistakes.
And I got to tell you, if you want to nominate me for anything, my career has been built on making mistakes every day. So I'm good at that one.
Well, I've done a few good things along the way, I might add. So now I want to turn to the last question for our panelists, and 1 minute each, because I want to get at least one question from the audience. As Wagner alums, how has that education experience shape your response to the pandemic? Each of you have 1 minute.
Very simple. You need good analytical ability. I mean, you can do it with your heart, but you also better know the data you have. You're going to have to deal with imperfect data. But if you don't do the analytical ability to kind of look at what's going on, you're not going to make the right response in situation. And some of the skill sets that were part of the Wagner curriculum really help to kind of focus on some of the analytics needed to make a good response, particularly in emergency situations.
Great. Jennifer.
Borrowing and building on what Monsignor Sullivan said. The analytics courses that I took, as well as the strategic planning, and policy making. In my work, appreciating how you cannot do policy work without having strong strategy and without having a really good sense of how to assess, analyze, understand data and data trends. So it's helped me significantly. May not have gone to law school had I known about Wagner beforehand.
I can relate. Erasmus. We still don't have Erasmus, so Alan.
Yeah, building on what Jennifer and what the Monsignor said, yes to all of it, but then also the emphasis on race and class as well. There are two pandemics that are or two crises going on right now in the city. One is the pandemic, the other is the reckoning on racial equity, and nonprofits are having to manage through both. And a lot of what I learned at Wagner helped inform some of the decisions we made recently, including to change the structure of our leadership team, which is our decision-making body. We announced last week that we are adding 10 new members to that body, all of whom are people of color. And for the first time in our 130-year history, a majority of our leadership team will be made up of POCs. And that is something that just isn't done in historically Jewish organizations. And a lot of that inclusivity and what I learned at Wagner helped inform that decision.
Great, thank you. And then let me turn to my colleague, Tom Hernandez, who's Director of Alumni and Student Engagement at Wagner. I think we're just going to have time for one question. So Tom, select the best question.
Oh, the pressure is on.
It is.
Okay, I think with the election just a couple of weeks away, folks want to know, what is the one policy fix that you would like to see from a potential Biden administration that would help with the work you do?
Okay, and why don't we start with Erasmus, if you're back, Alan, Kevin, and Jennifer briefly. Erasmus. We're still having challenges. Okay, Kevin.
Comprehensive immigration reform.
Comprehensive immigration reform, very simple and important. Jennifer.
Livable wage.
Livable wage. Tom, do we have time? That was, you guys are very good. Do we have time for one more quick question?
Gordon.
Oh, Alan, I couldn't remember calling you or
I
not.
just want to say money.
Money.
The Democrats taking back the Senate and a Biden White House will mean a lot of money that's necessary for all of us, both in Albany and in the city. There will not be a state or a city bailout unless those two things happen. And if they don't happen, we are in for a very long winter.
So what I heard was comprehensive immigration reform, livable wage, and money, pure and simple. So
And healthcare.
healthcare.
If you can hear me.
Yeah.
Sorry, I'm having some technical difficulties.
And healthcare to round it out. So
Yes.
I want to thank our Wagner panelists for a thoughtful and robust discussion around such an unprecedented challenge that's literally impacting us here in New York, the tri-state region, this country, and around the world. You make us proud. And there are so many other NYU Wagner alums who are on the front lines responding to COVID. And I want to thank you, the audience. Be safe, be well. Thank you. Good evening.